I'm excited to share some findings from our research that was recently published in the Journal of the American College of Surgeons. As brief background, it's well documented that patients with mental illness have worse outcomes after general surgery, but less is known about where along the phases of surgical care those disparities arise. Therefore, we aim to understand the effect of serious mental illness on consultation and operative management of older adults with acute biliary disease. In this national retrospective cohort study, we used Medicare claims data to identify patients who had been hospitalized with acute cholecystitis or biliary colic from 2016 to 2018. Our exposure was serious mental illness, defined as patients with a schizophrenia spectrum, mood, or anxiety disorder, and we removed patients with other mental illnesses from the reference group to create a more pure comparison. Our primary outcome was receipt of a surgical consultation. Our secondary outcomes were receipt of an operation and operative approach. Overall, there were 85,943 patients that met our study criteria, with 23% having a serious mental illness. Our serious mental illness cohort had lower socioeconomic status, higher rates of physical and substance use disorder comorbidities, and more severe preoperative presentation, as indicated by preoperative sepsis. In models adjusting for differences in baseline characteristics, preoperative presentation, and rates of imaging, older adults with serious mental illness had similar odds of receiving surgical consultation, operative treatment, and laparoscopic approach as those without. Given the documented disparities in surgical outcomes for this population, these results indicate that there are other opportunities to improve care delivery and address disparities elsewhere in the preoperative and postoperative phases of surgical care. Thank you, and I'd like to take a moment to acknowledge the funding and support that made this work possible.